Hi everyone, my name is Sandy Deek.
And my name is Neppy Samuel. We're excited to serve as speakers for this presentation on cultivating compassion in the professional training environment.
Nefi, can you think about the people or leaders that you have worked with who you admired and were happy to work with? What were their behaviors? How did you feel working for them? And what kind of worker were you and how do you feel about them now?
Sandy, I think that's an excellent question. And I really appreciated leaders who had integrity, who were skilled at delegating tasks equally and fairly, who had excellent communication, were self-aware, courageous, respectful. But I think what was most important to me was that they were compassionate towards their employees. One leader really comes to mind, and I felt more like a partner working towards a common goal compared to being just their subordinate. This really motivated me and pushed me to want to help them succeed and put my all into achieving our company goals. What about you?
I definitely agree. I think our world needs more leaders who are committed to leading with authenticity, courage, curiosity, and definitely compassion. And I say leaders, but I see myself, you, and all preceptors as leaders, whether we want to think that way or not, because we're leaders in that professional training environment. We lead and support our learners in that space. And so when I think back on the interactions that I have had with others, I think fondly about the people who held that safe space for me to think. And that is often what I needed the most. The people who would ask me questions and then listen openly without judgment and with such deep care. I felt that they had my best interest in mind throughout, and it was what kept me engaged and more effective. When I work with those people, I feel like I can give more, be more, and do more. And it is those experiences that makes me really curious about how do I create that space for my learners.
We hope that as we go through our presentation today, that you as our viewers will see potential and possibilities to grow your own precepting toolbox, and you will feel more capable and inspired.
Before we get started, we would like to first set the stage for learning. To help you get the most out of this experience, we will be asking you to engage in complete reflections and activities. These activities will ensure you internalize the learning and that you make the connections to your own work so that it is relevant to you and that you can use the knowledge and skills. You will be engaged with content through lectures, reflections, and practice exercises. You will also watch videos and listen to audio clips, and then join us in discussion and conversation afterwards. There will be several times throughout this presentation where we will ask you to pause the video to write and reflect on question prompts. We recommend having some place to write and take notes that you want to keep and come back to.
Before moving forward, let's review our learning objectives. Number 1, recognize the difference between pity, sympathy, empathy, and compassion. Number 2, discuss strategies to cultivate compassion in a professional training environment. And number 3, identify opportunities to cultivate compassion in a professional training environment. Over the last decade, there has been great interest in bringing compassion cultivation training to educators and learners alike. We know that the professional training environment is more than just clinical knowledge and skills acquisition. We know that this space plays an increasingly central role in cultivating the necessary social, emotional, and ethical skills required to lead meaningful and successful lives, both professionally and personally. Compassion is fundamental to our basic nature as human beings and is part of our everyday experience of being human. There's a growing body of evidence that suggests that at our very core, most humans have a natural capacity for compassion. In fact, it is suggested that it is a natural and automatic response that has ensured our very survival.
So Nefi and I are not here because we think preceptors, learners, or the training environment lacks compassion. We know that there's a natural capacity for it, and many of us have it. Despite this, everyday stress, social pressure, life experiences in general can make it difficult to experience and fully express compassion to ourselves and to others. The good news is that compassion can be nurtured and cultivated. We have more research and data that says compassion can be taught and trained, and by increasing our capacity, it improves psychological well-being, resilience, and social connection. So in summary, why is this important for us to talk about? Compassion is a key component of individual, interpersonal, and societal well-being. Thus, the cultivation of compassion can be regarded as an important practice. So before moving forward, please take a brief moment and write down what compassion means to you. We will start with inviting you to watch this video where Brené Brown, a research professor who studies courage, vulnerability, shame, and empathy, define empathy and sympathy, because oftentimes these two words gets confused. We will come back after to continue our discussion.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Before we move any further, we think it will be helpful to provide some definitions for these terms. While it's important to define compassion, we think it is equally important to define what it is not. The terms pity, sympathy, empathy, and compassion are often confused, and with good reason, because all of these words deal with the relationship a person has to the feelings and experiences of another person. In the context here, we will relate these words to suffering, because empathy and sympathy have roots in the Greek term pathos, which means to suffer with. So let's start with pity. Pity is different from compassion because, for one, when you feel pity, you recognize the other person's suffering from an emotional distance. And 2, your concerns are for someone you feel is inferior or weaker than you. And because of that, pity can carry a more condescending overtone.
So think about the deer in the earlier video. If that was sympathy, think about pity as even less engagement and more condescending than that. Like walking past the hole and saying, man, that sucks for whoever fell in there. Glad it's not me.
Sympathy was the deer in the video. Sympathy is, I care about your suffering, but I'm still maintaining some emotional distance and still less engaged.
In the video, Brené Brown talked about how we can sometimes silver line the suffering. My marriage is falling apart, and someone says to you, at least you have a marriage. And let's be transparent and say that we can sometimes find ourselves being the deer in the video. A learner can come to us and tell us that they are having a hard time balancing their rotation projects and being on site from 8 to 5 p.m. And we oftentimes say, at least you don't have to take care of children when you get home. I had it so much worse than you back in my day. At least you have all weekend to work on your projects.
And sometimes we don't even know that we're doing it. Oftentimes our intentions here really is to communicate that we care about what the other person is going through, but we don't know how best to do it. In my head, if I help them see what they're going through isn't as bad as they think, then those feelings will magically disappear, right? If my students say they're struggling with their job responsibilities and we respond by saying, that sucks, but it's not as bad as it will be when you are a pharmacist, what you hope will happen is they say something like, you know what, you're right, my suffering didn't meet that cutoff for what suffering actually is. I'm not suffering enough, so I'm going to delete my feelings of suffering right now. It's important to see here that what we're doing isn't actually helping the person process their emotions. What we're doing is helping them deny their feelings or not even giving them the permission to feel. And like what Brene said in the video, rarely can a response make something better. What makes it better is connection. And this is why sympathy is different from empathy. To empathize is to feel with someone, to see and connect with someone in their struggles, their pain, their emotions, and feelings.
When a student tells me they are feeling overwhelmed with managing their projects and being on site from 8 to 5 p.m., I can connect with them because I know what overwhelm feels like. I know what it feels like to struggle with balancing responsibilities. That is the meaning of putting yourself into someone else's shoes. I don't have to experience their specific experiences, but I can connect with them by paying attention to their emotions. I know what it feels like to be scared, anxious, and defeated. There's no at least here.
And then we have compassion. And compassion, simply put, is empathy in action. When you feel compassion, you are moved to take action to relieve someone else's suffering. Compassion is not only feel and see the other person, but to be supportive in some way. I think I have to be careful here about what I mean to take action. Compassion doesn't always mean fixing it. You can be compassionate without fixing the problem for the person. Sometimes compassion is just listening, or just asking the person what they need.
Right. Compassion isn't removing the projects off a student's plate because they feel overwhelmed. And if you don't do that, you're not a compassionate preceptor. No, that's not what we're saying here. We can show compassion towards our students by letting them know that they are not alone in their feelings and helping them work through it. Why are they having trouble balancing their responsibilities? If we can support the student to identify the root of the problem, then we can really work on problem solving. We can't get to compassion without empathy, though.
So for the remainder of our presentation, Nefi and I would like to focus on strategies on how we can best cultivate empathy and compassion in the professional training environment. Strategies to cultivate compassion. 1. Practice empathetic listening. 2. Pay attention to nonverbal communication. 3. Understand adult learners. 4. Practice self-compassion. Empathetic listening. Most people do not listen with the intent to understand. They listen with the intent to reply. Stephen Covey.
We will start our first strategy, which is empathetic listening, which is arguably the most important for cultivating empathy and compassion. Listening is something we think we all know how to do, and yet most of us can still improve our listening skills. In this section, we will be reflecting on how you listen and exploring different ways that can help you build awareness of your own listening.
Take a few moments to jot down some thoughts before you move on. How do you feel when you know someone is listening well to you? How do you feel when you're talking about something meaningful and you feel that they aren't listening well? We all have habits around listening. Many of us hear something and then in our minds a connection sparks, or we have a question or a desire comes up to contradict what someone is saying. At that point, we stop listening and we're focused on finding a space to make our point. And sometimes we space out. We call these mind journeys, the places our minds wander when we listen.
That's very true, Sandy. I remember when I first started precepting, I would often listen to my learner just to find errors or areas in which they needed improvement. I would go into the conversation feeling the need to offer advice, suggestions, tools to whatever they were saying. I was caught in urgency, and at that point, I don't have the impact that I do now with my learners. To grow in this area, we have to cultivate awareness of the mind journeys we tend to take. Take a minute to check off the journeys you know you take with your learners. We want to invite you to watch this preceptor and learner interaction. After you watch, we want to encourage you all to complete the following reflection prompts. What are you noticing during the interaction between a preceptor and learner? How do you think the preceptor is listening? Sandy and I will come back after the video to share our reflections.
So I just want to bring you in, talk about your midpoint evaluations, see how things are going for you.
Yeah, absolutely. I think I am actually really starting to hit my stride.
This student is so unaware. He's not passing my rotation right now. I should have known. He didn't do that well in the classroom.
I just wanted to address some concerns that I have about your performance. I noticed that during topic discussions and patient cases, it seems like you need a lot of help with your clinical knowledge, and it seems like you're really lacking a baseline understanding of some of the disease states recovering.
How can that be a fair assessment of my ability to do this job? This is the first time I've done this.
Never done this before. Is he serious? We do topic discussions every Friday, and he's been doing these for 3 weeks now. I don't understand why he's still not getting it. This is basic information. I know he learned this in school.
Well, you're not really participating in topic discussions, and I ask you questions, and you say, I don't know a lot, and the stuff that I'm asking you is very basic knowledge. I'm not asking difficult questions. And I think that if you want to pass this rotation, you're going to really have to put in some work and work a little bit harder. But I'm confident that if you spend more time working on this, then you'll be able to pass the rotation.
Okay. I thank you. I will certainly try my hardest. Thank you.
It's pretty great to hear what were some of the thoughts going on in the preceptor's mind. There were definitely some mind journeys there, and I get it because I do it too. Nefi, what was one of the journeys that you noticed the preceptor taking in the video?
Sandy, for me, I felt the preceptor had already kind of made up her mind about the learner and wasn't going in curious and open-minded. So I felt mostly she, according to the mind journey, she was feeling uncomfortable because to me, I sensed she was annoyed, impatient, and even at times judgmental. There was times when the learner was talking and her mind had wandered without truly listening to him and trying to put herself in his shoes.
Yeah, I noticed that too. I also noticed that the preceptor's thoughts were wandering towards disagreeing. So she sounds like she didn't agree with the learner when he said that he's never done this before. So she felt this was something that was discussed every Friday during topic discussion, and the material was basic information. The preceptor pretty much made the decision that she wanted to let the learner know that she disagrees, because later on she pointed out that he has not been participating in topic discussions. This interaction makes me curious about what the learner is probably thinking about. I mean, based on his response at the end, his mind may have been wandering towards feeling uncomfortable and probably trying to plan an exit to get out of this conversation. Because I noticed he ended the conversation with, I will try my hardest. And as he was saying that, he was almost kind of backing away, like he was preparing to leave. I don't know about you, but I didn't feel like there was a lot of empathy or compassion being communicated here.
Yes, and yeah, I agree. It sounded like most of the time it was almost like arguing, and they were more focused on trying to prove their own point rather than listening to each other and what the other person was saying.
I felt that way too. It makes me really wonder if either person felt heard after that conversation.
To help you build awareness of your listening, you're going to listen to short audio clips of two learners talking. Imagine you're precepting each of these learners. Your task is to listen and notice where your mind goes. You don't have to do anything special as you listen, except bringing awareness to where your mind is going. Are you spacing out? Are you thinking about what you would say? Are you judging your learner? Judging yourself? This takes a lot of practice. As you listen, you can jot down notes for yourself or use the mind journey sheet to make tally marks on the journey your mind takes. Or simply just listen and notice. Let's listen now.
You know, I don't think I did that bad. I actually thought I did okay. I know it's block 5, but this is my first time counseling a real patient. Can I be honest with you? My last preceptor didn't do a good job teaching me how to do this. He was just way too busy. And I know we were taught this in school, but that was like one time during P1 year. And it wasn't even with a real patient. The instructor who taught us doesn't even practice anymore. I wanted this rotation to be after mid-year, so I could really focus on learning, because right now, I just want to focus on preparing for mid-year conference.
I've been working so hard these last 3 weeks, and I feel like I'm not where I should be. I know I'm not super smart like Clinton. He gets here like 10 minutes before rounds, and he's good to go. I'm here 5 o'clock every morning, and I'm here sometimes until 9 p.m. All of my other friends who completed their internal medicine rotation said it wasn't that bad, and I did so well on all my other rotations. I don't know what's wrong with me. I'm working so hard, but I feel like I keep getting negative feedback from you every week. I feel like a total failure. You're telling me I'm not passing right now. How am I going to make it? Am I even going to get into a residency?
We know empathetic listening doesn't always come easy, and it may be awkward at first, but when we rephrase the meaning and reflect the emotion, we ensure that we are hearing precisely what the other person or our learner wants to communicate. You can try using these stems such as the ones shown here.
We want to be cautious about mimicking content. In this beginning stage, we are simply listening and repeating what is said. While it's a good start to ensure that you are engaged, empathetic listening involves more than just registering, reflecting, or even understanding the words that are said. The goal is listening to understand. You understand the world the way they see the world. You understand their paradigm. You understand how they feel.
So let's talk about triggers. Remember that it is more difficult to listen empathetically when we fill that space with our autobiography, our story, or interpretations, or whatever you would like to call it. So it's important that we attend to our own triggers so that we don't project our own story and assume thoughts, feelings, motives, and interpretations.
What do we mean by triggers? This term has been used to describe external events or circumstances that may produce very strong, emotional, and sometimes uncomfortable responses such as frustration, anger, sadness, or even embarrassment. These feelings can lead us to take certain actions like engaging in discussion, a debate, or argument, expressing things we later wish we hadn't expressed, freezing up in fear, or making a quick exit. So how do we know when we feel triggered? Sometimes your body gives you cues. You might feel physically uncomfortable, you might get a headache or stomach ache. It can vary from person to person, but it is whatever your body does when it's in distress. You might also notice judgmental thoughts that come through, like, I can't believe we have to talk about expectations again. Was she not listening the first time?
So there is a good chance you have already experienced this at some point, and there's a good chance that as preceptors, we will feel triggered in a conversation with our learners every now and then. After all, we are human. Neffy, what comes to mind when you think about what triggers you? What does it feel like?
Sandy, I can recall when I first started precepting, I would often feel triggered when a learner would undermine my authority. Like when they would say things to me like, my last preceptor told me this. Are you sure that's the correct answer? When they questioned my process, I felt they were attacking my intelligence. But what I found is that most of the time, the learners were just confused.
I definitely hear you for that one. For me, it's when I make a story about someone lacking accountability. It sounds like I was never taught this, so that's why I don't know how to do it. Or when I feel like someone only identifies problems but rarely provides solutions. Those are my triggers. Sometimes I can feel this like visceral reaction kind of overwhelming me. I can feel my body temperature rising, and then my mind starts to get all, I don't know, judgy.
Yeah, I've definitely had that happen to me before when I was precepting. Sandy, how do you deal with that when you find yourself in that situation?
Well, the first step is to notice that you are triggered and then you name it. So you and I are doing great already. The next step is to pause to acknowledge what is coming up for you or your emotions. So, are you feeling angry, sad, afraid? So, for example, for me, when I hear someone say, I was never taught this, so that's why I don't know how to do it, I feel irritated or angry, maybe. And so we are able to name the trigger, name the emotion, then that opens up opportunity for further exploration. And that is the next step, which is to investigate why you get triggered here. Nephi, you mentioned that when someone questions your process, you feel like your intelligence is being questioned. Why do you think that is for you?
Hey, when I first started, I was really trying to prove myself as a preceptor and even as a pharmacist. And when I had a learner question me, I became defensive because I didn't want anyone to doubt my abilities and what I had worked so hard for.
That's actually really interesting to hear. Thank you for sharing that because I felt like that takes a lot of self-awareness to get there. Sometimes this kind of exploration can take a little bit more digging, I think. So, my advice is to be patient with yourself here. It may be helpful to think about the values or beliefs that we hold in our lives. So, for example, if you're someone who strongly values responsibility and someone is coming into a meeting not having done their homework, you might feel triggered. Or if you value authenticity and you feel like someone is acting or being inauthentic, you might notice yourself having a strong reaction. So, after you've noticed that you're triggered, you name it, you acknowledge the emotions that come up, you investigate and dig a little deeper to find the why. The last step is to ask yourself in this situation, who do you want to be? Right? So, who do you want to be as a preceptor in this situation when you're feeling triggered by a learner? I kind of have this like record that plays in my brain over and over when I find myself getting triggered. Sandy, you're here to help them get it right, not be right. You're here to help them get it right, not be right. And it kind of plays like a broken record in my head. It's like I'm setting an intention for how I want to show up in that space. And I find that when you declare your intention, it makes it that much easier to step into that. Nefi, do you feel like you still get triggered when students question your process?
Honestly, Sandy, not much at all. It's definitely gotten a lot better. And I believe that's all because I've become very comfortable with that emotion. I've named it and have spent time exploring that feeling. I did a lot of investigation, even talking to students, and I realized many of them just wanted consistency, and really just wanted to know what the right answer was. I realized that, I when I asked myself, what do I want to be for them in this situation, that I really wanted to be a mentor for them. They get stressed when they get taught different things by different preceptors. So instead, I spend time exploring those feelings with them and working towards giving them the confidence to find the answers themselves in the literature and not having to rely on others when there is a discrepancy. So I really do think that these 4 steps can really help when those triggers do arise. Let's listen to the short audio clips of the learners talking again. But this time, apply what you just learned about empathetic listening. Write down what you might say and practice your response out loud.
I don't think I did that bad. I actually thought I did okay. I know it's block 5, but this is my first time counseling a real patient. Can I be honest with you? My last preceptor didn't do a good job teaching me how to do this. He was just way too busy. And I know we were taught this in school. but that was like one time during P1 year. And it wasn't even with a real patient. The instructor who taught us doesn't even practice anymore. I wanted this rotation to be after mid-year, so I could really focus on learning, because right now, I just want to focus on preparing for mid-year conference.
I've been working so hard these last 3 weeks, and I feel like I'm not where I should be. I know I'm not super smart like Clinton. He gets here like 10 minutes before rounds, and he's good to go. I'm here 5 o'clock every morning, and I'm here sometimes until 9 p.m. All of my other friends who completed their internal medicine rotation said it wasn't that bad, and I did so well on all my other rotations. I don't know what's wrong with me. I'm working so hard, but I feel like I keep getting negative feedback from you every week. I feel like a total failure. You're telling me I'm not passing right now. How am I going to make it? Am I even going to get into a residency?
So, Neffy, how would you respond if Sarah approached you and said that?
I think we've all been where this learner is right now. How we react when faced with failure or step back. I want to acknowledge that frustration and invite her to accept that it's okay to feel frustrated. And I want to acknowledge the inevitability of struggle and help them see that this is a part of the learning process. Oftentimes we have learners who approach learning with the belief that if they don't get it right away or if they frequently encounter struggle, that they can never learn it. As a preceptor, my goal here is to help this learner see that it's completely normal. Once we're able to shift that mindset to be more growth-oriented, then we can work together to get clear on what action steps this learner wants to take coming out of this conversation. So in a situation, I might respond with something like, yeah, I hear your frustration and I hear how tired you must be. I see that you're putting in a lot of effort into the work you are doing on this rotation. It's hard to work so hard on something and not feel successful. What do you think you need right now?
That's a great response. I love what you said about normalizing the struggle. If you want to learn how to ride a bike, you're going to have to fall a couple of times. You get back up and you try again and you keep going. It sounds like she had some fear about falling, which it's normal too. I, as a preceptor, can see myself easily falling into the let me fix it mode. And it takes so much effort to hold that back for me. And in my mind, I can also hear myself screaming, get out of this conversation right now. You're uncomfortable. Minimize, minimize, minimize. And so I can see myself responding with like, oh, don't worry, you'll be fine. Just work harder. So your response to Sarah definitely sound and felt way more empathetic.
Yes, I completely agree. How would you have responded to Clinton though?
So the Sandy from years ago when she first started precepting would probably get triggered by what Clinton said, and my mind will start wandering everywhere. I think I've come a long way. Clinton is coming into this conversation with a lot of information, and it looks like almost a list of complaints. He's all over the place talking about previous experiences, the curriculum, mid-year, and a lot of it seems to be out of his control. I have found what I think is a game changer for me, especially in situations like this one. I call it the sphere of influence. And this concept is quite simple. We classify our complaints into three categories. So, those that we can control, those that we can influence, and those that we can't control. The clarity that can emerge from this sorting activity frees up a lot of emotional energy and helps us see that we have more agency than we think. So, by asking Clinton to acknowledge what is outside of his control, might actually help him shift into discussing what is actually within his influence or control. So, I would probably respond with something like, wow, I'm really just taking all of this in. I'm hearing you're frustrated about many things. Of all the things that you've mentioned, I'm curious which ones are outside of your control. So, by responding in this way, this will hopefully generate new information for you that is more helpful. And sometimes you might need to follow up with something like, what would be the most useful for us to talk about right now? Notice in our responses to these scenarios that Nefi and I are also beginning to create a space to facilitate reflection, problem solve, and guide learning. We're not fixing anything here. We are simply rephrasing what was said in our own words and reflecting the other person's emotions. And so when done well, it makes people feel seen and valued.
Bringing awareness to our listening and listening empathetically are things we need to practice. It is a practice we can cultivate throughout our lives. Intentionally practice this kind of listening in as many conversations as you can. We want to leave you with a few tips as you continue to practice empathetic listening.
Paraphrase what the learner says without overinterpreting their words. We can get carried away sometimes with our own interpretations. Something that helps is to also say something like, "Did I get that right?" This allows space for the other person to verify or clarify as needed. Be cautious not to parrot what was just said. We talked earlier about how mimicking content is not what we want to do. We want to rephrase the meaning in our own words and reflect the emotions. Follow up by inviting the learner to clarify anything you might not have understood or missed. It is okay to ask for clarification. Again, when we listen, our goal is to seek first to understand or diagnose before we prescribe. And sometimes, like when we interview our patients, we have to ask some clarifying questions to clearly identify the problem. Craft empathetic listening stems that feel comfortable and sound natural for you. We shared some stems earlier in this section. Feel free to use those or create new ones that feel more natural to you.
Here are additional reflections that we think will help you as you continue to practice empathetic listening. Are there mind journeys that you want to set as an intention to take less frequently? Which ones? What needs to happen so that you can take those mind journeys less often?
Nonverbal communication. When we misinterpret someone else's body language, we can miss an opportunity for connection. Elena Aguilar.
Sometimes it is hard to listen when there are no words being said. It is said that about 65% of communication is delivered and received nonverbally in the way we stand, our gestures, facial expressions, and eye movements. These behaviors are often subconscious, but they're important because it gives us a clue into someone's state of mind or attitude. I've noticed that nonverbal cues are often what gives me the deepest insight into what's going on with the learner. And when I've felt stuck about what to say or do next, it's because I haven't been paying close attention to the nonverbal cues. Like all other strategies, this is a skill that can be strengthened and developed if it doesn't come instinctively to you.
So for this next section, we will talk about how you interpret nonverbal communication or body language of others and how bringing awareness and knowledge to this can influence the relationship you form with your learners. What are you noticing and what do you think each of these pictures are conveying? Pause this video and take a minute or however long you need to answer this question. Sandy and I will come back and continue our discussion on this topic.
To cultivate trust and build relationships, we need to be conscious of what I like to call these nonverbal cues. There are 3 places to pay attention to: the face, the arms, and the shoulders. You can start with the face. For many of us, facial expressions reveal a great deal about how we feel. Pay attention to the brow area. Are the brows furrowed? Are you noticing their jaws set? Are their lips pinched? What about eye contact? Are they looking at you or looking away or somewhere else? For example, if I asked a learner if they would like to present their in-service to a group of physicians, and the learner is nodding and saying, "Yes, I can do that," but her lips are tight, her brow is curling inward, and she's looking away from me, her words might not actually be aligned to what she is truly feeling.
You should also pay attention to the arms. Crossing your arms over your chest could mean you're cold or that you're feeling nervous, defensive, or protective of yourself. And for the opposite, if you see people unfolding their arms, That could also mean they're opening up, feeling less nervous.
And the last part to pay attention to are the shoulders. We sometimes unconsciously move our torso into ways that reflect how we're feeling. Are the shoulders hunched, curled over, or are they opened and relaxed? If someone leans towards you while you're talking, that can be an indicator that the person is receptive and engaged. If the person leans backwards, that can indicate wanting to move away from you. So let's take a look at the 3 pictures on the screen and talk about what we notice here. Looking at the first picture, the person in the pink colored shirt seems to be expressing some sadness with her facial expressions. She appears to be hunched over, which may suggest worry, nervousness, or maybe even fear. When we are ashamed or embarrassed, unconsciously we might fold in on ourselves, making ourselves small.
Yeah, and the second picture makes me think that this person's feeling uncomfortable. He appears disengaged. He's not really making any eye contact. His gaze is looking down or even away. He appears to be leaning back, which may indicate he's uncomfortable and want to move away from you or the conversation. Even his arms are crossed, which can suggest that he's nervous, defensive, and even self-protective.
In this last picture, I'm noticing the furrowed brows and pinched lips, which may suggest that this person's having some feelings of concern. This person is also rubbing or scratching the back of their head, which makes me think of signs of confusion, doubt, or maybe even uncertainty.
We will further explore nonverbal communication in the next set of slides.
For this next section, we want to invite you to watch this interaction between a preceptor and her 2 learners. We will do this in 3 parts. By doing this activity, we hope it will hone your awareness of how you interpret other people's nonverbal cues. For part 1, you will be watching the interaction without any sound. As you are watching the video, we ask you to pay attention to nonverbal cues and take notes of your observation. For part 2, you will be watching the same interaction again, but this time with sound. This will allow you to notice how the nonverbal cues align or do not align with what is being said. For part 3, you will be listening to the internal monologue that went on for each person. This will give insight on their state of mind and allow you to see how their thoughts align with their verbal and nonverbal communication. Let's complete part 1 now.
Let's take a moment to reflect upon the video we just watched. What message do you think each person is communicating through their nonverbal cues throughout the video?
Now we invite you to watch this video again, but this time with sound.
You guys ready for this atrial fibrillation topic discussion? That's so exciting. So let's get started. What do we kind of use for AFib?
Absolutely. And so patients who have atrial fibrillation, they need to have treatment for rate or rhythm control as well. They need to be assessed for anticoagulation therapy for possible stroke prevention.
Good, good. And so how do we assess if a patient needs to be anticoagulated?
Yeah, we actually just use the CHA-BAS score.
Cool. And so can you break down the scores for me after the CHA-BAS?
100%. So when we look at the score, we break it down into two different categories. We have low risk, who possibly patient will not even need anticoagulation therapy at all. Or if your CHA-BAS is actually 2 or greater, they could possibly be a candidate and they will actually require therapy.
All right, good job. Lex, can you guys tell me what we would use for anticoagulation therapy?
I'm sorry, I don't remember.
Okay, well, what about naming some rate or rhythm control agents?
No, I'm sorry, I just don't remember. I can't.
Okay, well, why don't you go read up on it and then meet me in my office in like 30 minutes and we can talk about some answers, okay?
Yeah, sounds great.
All right.
Were you surprised by the data you gathered from earlier? Why or why not? Now, for part 3, let's dive a little deeper into each person's mind and listen in on what they're actually thinking.
This is great. My 6 weeks in anticoagulation clinic last rotation is really paying off. The rotation is going to be a breeze.
Dang it, she called on me. Okay, think. I think it's the new oral anticoagulants like a Pixaban, but no, I'm afraid I'm gonna look stupid. What's wrong with me? I spent hours studying for this, but I'm afraid I'm just gonna fail this rotation if I say the wrong answer. I just can't do this.
Why isn't Lex engaging? This is the 3rd time that he's not been prepared for topic discussion. This is the last straw. He doesn't remember? I gave him time to review beforehand. He must not have been prepared.
What insights have you gained from doing this activity? We just got a lot of great information. I definitely had to watch part 1's video like 3 or 4 times to capture all of my observations. Where should we start?
Yeah, I think we should start with our initial observations. What did you notice about Clinton's nonverbal cues?
Okay, so without context and just observing their body language in part 1, I started with paying attention to Clinton's face. He seemed to be maintaining eye contact with the preceptor during the interaction. Aside from that, he was somewhat had a neutral facial expression throughout. His arms are to his side, and at the beginning, he was kind of playing with his pen, which may have just been a subconscious habit of his. And then later, as he was talking, his hands started to move around. His shoulders appeared opened and relaxed. He leans back with one leg over the other, and when he was talking, I noticed he leaned forward towards the preceptor. What did you notice about Clinton's nonverbal cues? What did you think his body language was saying?
I noticed how relaxed he was throughout the entire interaction. He almost had this confident aura about him.
Yeah, I thought the same thing. He seemed pretty comfortable with whatever they were talking about. Okay, so what did you notice about Lex's nonverbal cues?
So, with Lex, it was more difficult to capture his facial expressions because I felt like most of the time he was looking down and his hands were rested on one side of his face most of the time. For most of the interaction, I noticed there was minimal eye contact that was being made by him. He wasn't looking at his preceptor or even Clinton. His eyes stayed looking down. It was only towards the end, as the preceptor was starting to walk away, is when he turned and looked at Clinton. And one of his arms, like I said earlier, was on the table and he was resting it in his face. The way he was sitting was different from Clinton. Lex was like leaned forward the entire time, but almost hunched over and facing down.
Yeah, I agree. His nonverbal communication was like the opposite of Clinton's. With just paying attention to his nonverbal cues alone, he seemed disengaged. Without any context, again, just looking at even the still snapshot picture, it's probably reasonable to say he looks bored, but what we know now is that's not what he was actually really feeling.
Yeah, you're right. If I didn't hear what was actually going on inside Lex's brain, I would probably think the same thing as the preceptor in the video. Speaking of the preceptor, it was very interesting to see how her nonverbal communication changed as the interaction went on. Her facial expressions looked fairly neutral at the beginning. Like I saw her nodding her head up and down when Clinton was talking, and she maintained eye contact throughout the entire interaction. Even her expressions on her face changed when she started talking and engaging with Lex. I noticed her eyes started shifting to her computer and her lips were pinched. I don't know if you noticed that, but I think I saw her eyes roll at one point.
Yeah, I noticed that too.
The preceptor's arms were like clasped together in front of her when she was facing Clinton, but then she had one arm on her hip towards the end. Her shoulders remained pretty open throughout the video, and her body faces towards the person she's talking to. How did you interpret the preceptor's nonverbal cues?
So initially, she appeared agreeable and non confrontational. I noticed the change too when she started talking to Lex. I started to sense some uncomfortability, maybe even irritation or frustration. The eye rolling with the one hand on her hips definitely gave me the I am annoyed vibe. She appeared a little distracted almost towards the end. Again, without any words, I got a sense she may not have been very pleased with whatever was said. Nefi, were any of your initial interpretations accurate after you watched the video again with sound?
Yeah, surprisingly, I did pretty good. I definitely can understand how all of this can happen. I'm not surprised how Lex's nonverbal cues can be seen as someone being unprepared or even bored.
Believe it or not, I find myself in this situation quite a bit. I do weekly topic discussions on rotations with my learners, and it's usually done in a group setting. And there's usually one or two who are more quiet and reserved. Initially, it was easy to assume quiet equals didn't do your homework or not prepared, but I realized that that's not always true. And so I learned that rather than making assumptions and interpretations of what I think I'm seeing, I try my hardest to stay away from judgment and just kind of note my observations, and then I have a conversation with the learner later about it. Because I know that if I start to create a story based on what I see, I can show signs of frustration, and we know that frustration often does not help us be more productive. I find that it's harder to be compassionate when anger and judgment shows up to the party.
Yes, definitely. What we just saw was what happens and appears to be a very confident learner next to a not so confident learner. And I can imagine how that can be somewhat intimidating for a person who's not confident. Looking at the scenario, now knowing the full picture, we know Lex isn't bored or unprepared. He's actually just nervous, uncertain, and even a little scared, maybe even embarrassed. And perhaps if the preceptor knew that about Lex, then she may have thought and perhaps acted differently. Now, the preceptor seemed to have picked up on these nonverbal cues, but misinterpreted what Lex's body was actually saying. And I'm curious how Lex's interpretation of his preceptor's nonverbal cues affected what he is already feeling, perhaps adding to his nervousness, his embarrassment, and his fear. I suspect what just transpired did not help Lex feel any more confident.
I can definitely agree with you on that one.
Yeah, so while noticing these nonverbal cues do give us insight on what is going on, the activity we did just reminds us that it's important to also be mindful about the interpretations and the assumptions that we can make. We also have to recognize that there are cultural and even gender differences in like how we communicate nonverbally. And misinterpreting someone else's nonverbal can be just as bad as not recognizing them at all. We not only miss the opportunity for connection, but we can take actions that have a very negative impact. Oftentimes, instead of making your own interpretations, we should ask for clarification from that person. By communicating what you're noticing, it will allow for confirmation or clarification and can further open up that conversation.
That's a great point to make. When I'm having a conversation with my learners, whether it is to provide instructions or give feedback, I like to notice what they're doing while I am talking. So, for example, when I give an assignment and I notice the learner's eyes immediately go wide and their posture kind of straightens up, I might say something like, "So, the expression on your face makes me think that you have some concerns or anxiety about what I just said. Would you like to talk more about this assignment?" I feel like when I do this, it opens up a conversation into what they're actually feeling, and this also helps me avoid misinterpreting anything. Can you think of a time when your nonverbal communication might have been misinterpreted? Feel free to pause this video to reflect on this question before moving forward. To extend your learning from this section, next time you engage with a learner, pay attention to nonverbal cues and take notes of your observation. You don't have to interpret anything, just note descriptions of what you see. Kind of similar to what you did in part 1 of the activity from earlier. So for example, my notes will say something like, "When I asked, 'How did that discharge counseling go for you this morning?' her eyes opened wide, her eyebrows raised, and she sat up straight, and then she looked at the other student." So try to do this without making any interpretations. Interpretations sound something like, "Her eyes show fear and looked at the door as if she wanted to run away from the office." By doing this, we hope you can continue to strengthen your awareness when it comes to nonverbal communication.
Adult learners. Paradigms are powerful because they create the lens through which we see the world. Stephen Covey.
Understanding how adults learn is foundational to how we view our learners and is essential to effective precepting, which is why it's important to talk about. Learners come into the professional training environment with the desire to learn and grow. While their own goals may be focused on increasing their knowledge base or improving their clinical skills, they will not reach their goals without learning. By understanding how adults learn, it can help preceptors gain perspective and a more comprehensive, thorough understanding of a situation. And with a deeper understanding, we will be better able to tap into our compassionate nature and determine the most effective actions to take to change or improve a situation. So in this section, we will start with defining and reviewing the principles of adult learning and questions that may arise in reflection, planning, or during a conversation with our learners as it relates to adult learning. We will then ask you to apply the lens of adult learning so that you can appreciate and understand the complexities of situations. We hope by engaging in some of these activities, it will increase your capacity to better understand adult learners and precept more strategically and with compassion. Like I mentioned earlier, it is important to talk about the lens of adult learning because it will give you a way to understand and connect with your learners and help you focus your precepting in the right direction. So you may be asking, what do you mean by lens and how can I use one? A lens is just a metaphor to describe the idea of looking at evidence from various perspectives. The concept here is that we can look at the same thing from different lenses and different angles and create different interpretations of the same reality. It is how we make sense of the world around us. These lenses are based on the theories that attempts to explain human behaviors. When we look at something through a particular lens, it allows us to focus on certain things. The one lens that we will explore in this section is the lens of adult learning.
Adult learning follows these general principles or concepts. That means that these principles are what is informing how we see and make sense of things. These key principles are listed on the left side of this table. On the right side, you will see a list of questions. Preceptors can ask these questions to your learners or even to yourselves to help you gain more insight about the situation, problem, the other person, and even yourself. Take a moment to read the key principles and questions and write down any reflections or thoughts you may have. You can pause this video and do this now. Sandy and I will be back to discuss more about the lens of adult learning.
When it comes to adult learning, what is essential is understanding who we are working with. We're not working with a blank slate. This is someone who is coming to us with previous experiences, knowledge, competencies, beliefs, and interest. And that person is bringing all of that into this shared learning space. So we have to be aware and mindful about attending them. We're often building on what they already know, and on some occasions, we may have to help that person unlearn something that is not serving them. So in order for us to extend learning, we need to understand what experiences someone has had, and then we need to create more meaningful experiences for learning. We also have to accept that people can only be where they currently are. Adults want to be origin of their learning, and they want control over the what, who, how, why, and where of their learning. We will commit when we believe that the objectives are realistic and important for our personal and professional needs. Adults need to see clearly the relevance of what they're being asked to learn, and they need to have some say in what they are doing. We need direct instruction and modeling on how to apply what we have learned to our work. We do not learn simply by seeing or reading. We need application. So the information isn't automatically transferred into daily practice unless there's someone that will support us and provide meaningful feedback. Without feedback and facilitation, it will be difficult to sustain new learning or reach a level of mastery.
Sandy, a lot of this sounds like the 4 preceptor rules: direct instruction, modeling, coaching, and facilitation.
Yeah, you're right. The 4 preceptor roles are based on adult learning theories, which is why they're so effective. And lastly, the list of questions are helpful to consider when we're looking through the lens of adult learning. So these questions really help me stay curious when I'm working with other people. And like I said before, these questions can help you gain more insight about the situation, problem, the other person, and even yourself. So these questions can further expand our viewpoint even more so, that we can approach a situation with more clarity, and ultimately the actions we take are more strategic, informed, and productive.
In this section, we will apply your understanding of what the adult learning lens to a situation between a preceptor and learner. Imagine yourself wearing glasses that allow you to see only the elements relevant to the lens of adult learning. We would like for you to reflect on the following. What adult learning principles are helping you understand the situation? What insights do you have about the situation when you are considering these adult learning principles? What questions come up for you that may provide further insight on the situation? It may be helpful to refer back to the previous slide with the key principles and questions. We will be back to share our reflections and thoughts about this interaction after the video.
Hey, Dr. Lopez.
Yeah, what's up, Clint?
Patient back there in 730. I'm looking at the chart after round just now.
Okay.
I think patient would really benefit from apixaban 5 milligrams for atrial fibrillation.
You know, that's actually a great idea. Let me run that past my attending, and we'll see if we could get that started.
Okay, thanks a lot, Dr. Lopez.
I'll talk to you later.
Yeah.
Can you believe what my student did today? They literally made a recommendation without telling me, just went above me. And I had to go find the resident myself and tell them to use apixaban 2.5 instead of 5. Was he trying to overstep me? I spent so long working on the relationship with these residents, with these attendings, and now they're going to think my students are idiots, and now they're not going to trust me. Yeah, you're right. I'm going to talk to him. I'm going to talk to him because this is not appropriate. Thank you. Thanks. Okay, I'll talk to you later. Hey, I just wanted to bring you into my office because I heard what the recommendation you made to the resident today, and I heard that you recommended apixaban 5, and I just followed up and I looked at the patient, looked at their charts and looked at their creatinine clearance and their weight, and they should have been on 2.5. And so we didn't really talk about that recommendation. That's a patient hazard, and doing things like that can ruin the relationships not only that I have made with the residents and with the physicians and the attendings, but can also put our patients in danger. So I just wanted to let you know, you cannot be doing that.
Right. I am so sorry. It was not intentional, and I really did not mean to make that mistake.
Yeah, no, that's okay. And I just want to let you know that, anytime we're making a recommendation, it needs to go by me because we can't risk making mistakes like that again.
Absolutely. I will be sure of it.
Yeah, absolutely. Thank you.
I just met with Dr. O'Hara. Mm-hmm. She yelled at me. She embarrassed me. She said that the apixaban dose that I gave in rounds was wrong.
Yeah, for 7:30?
Yeah, right. I had no idea that I was not allowed to give that dose. I had no idea. From topic discussion the other day, we learned about it. I looked it up in the guideline, boom. A Pixaban right there. You know
That's
what I
it.
mean? Yeah, right there. You know, and she like went on this tangent about how I ruined the relationship with the doctor. Yeah.
What?
You know, I felt super guilty after the fact. She said there's gonna be consequences. Man, she's seriously like, I'm gonna be honest, she's so rude. She's so rude. And so, you know, like, I don't want anything to happen to the patient, really.
A classic story of unclear expectations. My heart goes out to both the preceptor and the learner, and I have so much compassion for both parties here.
Yeah, I can definitely relate to the preceptor in this scenario, and I've definitely dealt with similar situations when I was precepting. I can recall as a preceptor when I started early on that I wanted to make sure that me and my students were showing our best foot forward to our family medicine team. And I would feel like threatened when my students would do anything to harm that relationship. But I can also relate to the student here. I remember wanting to impress the physicians with what I had just learned. And it would give me like so much accomplishment when the physicians on service would appreciate the support I gave as a student. What do you feel about this, Sandy?
There's quite a bit to unpack here. So I guess we can start with putting our adult learning glasses on and reflect on the key principles and looking a little bit more deeply into the interaction so far. From the perspective of the learner, so why don't we start there? The key principles that help me better understand the situation, adults want to feel safe and they want agency in their own learning. So I'm hearing that the learner felt embarrassed afterwards. I don't know if you were able to catch that part, Neffy, which makes me think that the learner didn't feel that psychological safety to engage in a more productive conversation with the preceptor. And that safety is so important for adults to learn. I'm wondering what kind of feedback the learner has gotten and the level of independence he's had on previous rotations, because maybe he had more or less of that previously that we don't know about. I'm also curious about what the conversation looked like when the preceptor and learner discussed expectations of this rotation. I see that the learner does have some self-awareness, so that's good, saying that he does admit that the oversight can cause patient harm, and so he feels that sense of guilt. But I'm not sure if he's able to engage with those feelings. He seems to be more upset about the interaction that took place with his preceptor.
Yeah, I think those are great thoughts about the student's perspective, but from the perspective of the preceptor, the key principles that really help me better understand the situation is that it's really important to find out where people have been and where they're going. It sounds like the preceptor had been working hard to build a relationship and trust with the providers, and it does make me wonder if this preceptor has previous experiences where she felt like that had happened to her before. Perhaps she's drawing from those past experiences where there was like a loss of provider pharmacist trust due to a similar situation like that one. It seems like the preceptor went right into the conversation with the learner without acknowledging or even considering the learner's perspective. And it makes me curious if she is aware of the learning space she is creating. I think providing an opportunity to hear the learner's perspective can really help cultivate compassion here. It appeared that the intention of this interaction was to reprimand and to notify the learner about the consequences of this interaction. And it sounded like the preceptor already corrected the error on her own, which makes me wonder if the preceptor can even see the potential or knows how to use these situations as opportunities for further learning.
Yeah, the irony of this entire situation is that both the learner and the preceptors felt similar emotions, right? I'm sensing fear, embarrassment, maybe some shame, frustration, disappointment about what just conspired. And I see how both parties contributed to how the situation played out. I sense that both parties are bringing in their own insecurities and interpretations into the situation rather than curiosity about the situation or each other, which really can make it difficult to bring compassion into that space. The preceptor and learner felt left the conversation feeling probably frustrated still and unsupported. It makes me wonder what their relationship will look like moving forward on the rotation, because I imagine there's going to be some rebuilding of that trust that's going to have to occur. Let's observe a different approach to the same situation. Then answer the same questions. What adult learning principles are helping you understand the situation? What insights do you have about the situation when you are considering these adult learning principles? What questions come up for you that may provide further insight on this situation?
Hey, so I just brought you in. I overheard you making a recommendation to the resident for 7:30 about the Apixaban 5. I just want to kind of see what your reasoning was behind that and how you got to that recommendation.
Yeah, of course. So I applied what we learned in topic discussion last week. I calculated out his CHADVAS score. It was 4. I applied, I did a lot of research. Was it not appropriate?
I just didn't get the chance to talk to you about that recommendation first. Did you happen to look at their age and their weight and their serum creatinine, or if the patient has insurance before you recommended that?
Honestly, no, I didn't. I just used that CHADVAS scores. I really missed all of that.
Mm-hmm. Yeah, well, I'm glad that you are taking the initiative and applying what you learned. Just in the future, it would be helpful if we discuss our recommendations before you take it to the provider, just so that I can help guide your knowledge and help you make the best recommendation. So why don't we run back to the resident and kind of tell them that we're going to check the dose and then follow up with them later, okay?
Absolutely. Thanks so much for catching that. I will be better about it next time.
Absolutely.
So for this last video, we didn't really get a chance to hear about how the learner felt about his interaction with his preceptor, but we can only hope that he felt more optimistic leaving that conversation. Let's talk about how we felt about the preceptor's approach this time.
I got a better sense that this preceptor had her adult learning glasses on. I felt that she was drawing on the principles that adults want agency in their own learning, they want feedback, and I felt that she held on to the concept that people can only be where they are. I almost can see the thinking that kind of was going on in this preceptor's mind. So instead of jumping to conclusions and making assumption that the learner was trying to overstep, she actually stayed curious and wanted to hear more about where this person is in their learning and where they were coming from. Because she wasn't sure, she asked the learner about his thought process behind his actions. She also is asking the question to herself, what is going well, and therefore was able to acknowledge the learner's willingness to take initiative.
I completely agree, Sandy. The space definitely felt more safe for the learner, and the conversation sounded more productive compared to the other video that we had watched. You can tell the student felt more engaged to discuss their feelings and their thoughts because the preceptor had built a safe space for this to occur. This was likely because, from what I could sense, there's more compassion coming from that preceptor. She definitely was practicing empathetic listening more than that first scene we saw. I felt also that the preceptor's approach was much more learner-centered. When she said, this will allow me to help guide your learning, instead of saying, this will ruin the relationship I've made with the providers. Sandy, listening back to that last scene, is there anything that you would have done differently?
That's a good question. As a preceptor, I hold pretty strongly to the principle that adults want agency in their own learning. So in my mind, I'm often curious about how is this person owning their learning and how can they own it more fully? So I think it's helpful to let the learner kind of reflect on their own mistakes and have them articulate the possible consequences of oversight, such as this one. We don't want to just say, okay, be more careful next time, or minimize the gravity of the error, because I think in this situation, something like this can really serve as a valuable lesson. So I may want to ask something like, what do you think would be the consequences if this error was not caught? Or what would you do next time to ensure a situation like this doesn't happen again? And maybe even like, what do you think would be the best approach to take right now to correct this problem? So instead of solving the problem for them, my intention here is to create that space for the learner to reflect and kind of take agency to resolve it themselves. I actually would much rather that the learner come to the conclusion on his own that we should notify the physician as soon as possible in this case.
Sandy, those are all really great points and really good questions. So I completely agree with you. The purpose of the videos we share is not to show you the exact way you should be precepting. It is to expand on the different approaches and strategies that preceptors can take to stay curious and compassionate in a shared learning space. We also know that this may not come easy and it may be uncomfortable initially. Think about how you would approach a situation. We all need to practice, so this is your chance to explore the lens of adult learning for yourself. What would it sound like, look like, and feel like for you to respond while looking through the adult learning lens?
So we also like to invite you to extend your learning about this topic by applying these adult learning glasses in your everyday. So set an intention to put these glasses on for a week and take notice of your observations. You might even want to look at yourself with these glasses on. Have fun with it and happy exploring. Self-compassion. First, be friendly to yourself. Margaret Wheatley.
I don't really see self-compassion as different than compassion for others. Just as with compassion, where we need to recognize someone's suffering and take action to help, self-compassion comes in when you personally are suffering or dealing with a failure or difficulty. And it's when we recognize our own emotions and extend kindness to ourselves by giving ourselves grace so that we can take action to make change and move forward. The problem is most of us are probably more compassionate to others than we are to ourselves.
In this section, we will start with reviewing the steps needed when we need to take a self-compassion break. We will then ask you reflection questions to evaluate how compassionate you are to yourself as a preceptor. We hope that this section will cultivate your capacity towards being compassionate towards your own suffering and mistakes, and in turn will help you become more compassionate towards your learners. Compassion for others must begin with self-compassion. You cannot have true compassion for others if you do not have it for yourself. In all of the compassion training, reading, and research that we have come across, it talks about how it is important to first to recognize that compassion starts with yourself.
Thus far, we've been working towards cultivating compassion towards others. Compassion when you respond in the face of someone else's suffering. However, you cannot proclaim compassion and care for others without extending that to yourself. If you do not believe that you deserve to be free from suffering, how can you believe that your compassion for others is true? If you aspire to hold compassion for all, you must include yourself among the all.
So to practice self-compassion, when you feel overwhelmed by stress, disappointment, shame, or suffering, try to follow these 3 steps. 1. Recognize and name the painful emotion that arises due to difficult circumstances and our own inner critic. 2. Remember you are not alone. 3. Extend kindness to yourself when you make mistakes, fail, or suffer. Think about a recent challenging interaction with a learner, one where you feel bad about or for which you have judged yourself as a preceptor. Perhaps you snapped at a learner and afterward felt ashamed. Imagine reliving the moment, but this time, take a self-compassion break. For each of the 3 steps, write down a phrase that feels most comfortable for you to say in that moment that keeps the essence of the meaning. We hope by doing this, you essentially prepared an intervention plan for yourself when you need it the most. I think about emergency drills you have to practice before disaster strikes. By preparing a plan for yourself, the next time you make a mistake, fail, or experience difficult moments with the learner, these statements will serve as an anchor to ground you when the self-critic or judgment comes flooding in. So for example, when you recognize and name a painful emotion, you may say to yourself, this is stress. This is an opportunity to learn. To remind yourself that you are not alone, you may say something like, what I am feeling is normal. We have all felt this way before. And finally, to remind yourself to be kind to yourself, you may say, right now, you are doing the best you can. Feel free to use any of these statements or create your own, ones that you feel most comfortable with using.
The first step towards self-compassion is to recognize that painful emotion that arises when a difficult situation occurs and when your inner critic begins to talk to you. For example, imagine you receive your evaluations from your learners regarding your precepting skills. And it wasn't exactly what you were expecting or hoping for. You might initially feel embarrassed, but also a little angry toward your learners because of how much time you spent and put into precepting and how they don't appreciate it. You might then start to feel a little ashamed for blaming them for the low scores. And you might start getting mad at your own self because you didn't do enough as a preceptor. What if I had given them more time, more experiences, more feedback? Why do I always do that? I should have done this instead. These are the feelings that often arise during a difficult circumstance and when our own inner critic comes rearing its head. The first step towards self-compassion, as I mentioned, is to be able to recognize these very emotions and name them without judging yourself for having them. Allow these emotions to settle for a moment. By recognizing and naming these emotions, you're giving yourself the energy to look at the situation and to learn from it, rather than just shutting down from potential growth.
Nefi, I love what you're saying, but I think it is important to point out that self-compassion does not let you off the hook from looking at your own actions, growing and changing, or taking responsibility for your part of the problem. Self-compassion is simply about extending kindness to yourself so that you can have the strength and energy to examine yourself and make changes. It's about refraining from judging yourself harshly and berating yourself.
Yes, Cindy, you're completely right. But because we're humans, it is sometimes so hard to admit when we step out of line or if we're rude or act impatient towards our learners because our egos feel so much better when we project our flaws or shortcomings on our learners. It's their fault, not mine. It's because they did this that I did this. It's hard to be fully self-compassionate if we don't see ourselves clearly, even for the flaws that we have. We might temporarily feel better about ourselves by ignoring them and blaming them on our learners. But in the long run, this will only cause more harm and lead to an endless cycle of stagnation and conflict between you and your learners. No matter how much we'd like to blame our problems on someone else, we just simply can't. It's not surprising that we hide from the truth, though, because listening to our inner critic can feel harsh sometimes. But I'm not surprised by this because we live in a world and time where we're constantly comparing ourselves to others. How come my learners never tell me that they enjoy my rotation like they do with so-and-so? How come they never tell me how much they learned and how grateful like they do with that other preceptor? Listening to that inner critic can cause an incredible amount of emotional pain. We begin to lose faith in ourselves and start doubting our potential and sometimes become hopeless because that goal of being the best and the greatest preceptor sometimes feels frustratingly out of reach. We have to invest all of this time to our learners while completing our job responsibilities and managing our work and home life balance. How can someone do it all? And no matter how well we do, someone always seems to be doing it better. So sometimes it just seems easier to just ignore our flaws and blame it on our learners.
Yeah, I've been in all of those situations before. I find that my inner critic is usually the loudest when I am exhausted or overwhelmed or sleepy. So, depending on the day and the time and where I am and what I'm doing, getting this type of feedback makes me feel either defensive or I completely dismiss it or I just want to crawl under a rock and never want to come out. I know that I'm not alone in those feelings because I've seen this happen with other preceptors. It's in these situations, know that you are human and we all make mistakes. Refrain from judging and evaluating yourself altogether. Treat yourself with the same kindness and compassion you would show a good friend. Know that your personal sense of well-being shouldn't be dependent on every learner accepting and praising you. When you base your happiness on every learner's opinions, you will be subject to far too much emotional turmoil. Don't get me wrong, we should care, you need to care, but maybe not too much. But open to hearing criticism that is useful and true. Don't automatically reject it. Listen with an open mind, ready to learn and grow. So the one-liner here is give yourself some grace and you'll find it easier to handle criticism.
Sini, these are all really good points. And I think, though, it's important to recognize that we shouldn't go on the opposite end where we're having self-pity, which is when someone says, woe is me, poor me, I'm the worst preceptor, or why am I the only one who has the most difficult learners? It's so easy to fall into this trap. Sometimes it feels like you're the only one dealing with all the struggles of precepting. But the reality is being a preceptor, more so just being a human, means that you're imperfect and we will all make mistakes just like everyone else, you know? So once you recognize that, you can actually feel more connected towards your learners when they make mistakes. Imperfection is a shared human experience, and we all make mistakes. At times we get frustrated, embarrassed, angry, sad, ashamed. Know that you're not the only one that makes mistakes. Do not let yourself get lost in those fears that arise from making an error with your learners. This is the second step towards self-compassion, knowing that you're not alone. Making mistakes is part of being a preceptor, and it's completely normal to fail. We can't get it right all the time. We are all works in progress.
And once you recognize that, you can extend kindness to yourself when you make mistakes, fail, receive criticism, or suffer. It can sometimes be helpful to talk to yourself saying that, hey, that wasn't your best rotation block, but that's okay. It wasn't terrible, and you did what you could with the circumstances you were given. Everyone has learner experiences that aren't great. We can't do it all great all the time. But what can I learn from this experience so that I can do it differently next time? I think that's the piece that's important. And this is the last step towards self-compassion, and sometimes it's a difficult one. But if we can extend kindness to ourselves when we make mistakes, just think about how much compassion we can show our learners when they make them.
Now that we've completed talking about self-compassion, let's take a moment to reflect. Have you ever compared your precepting to another preceptor? How did that make you feel? How might your precepting be different if you raised compassion for yourself?
I think the most important thing to take away from this section is really to trust yourself to not be all the time calm, gentle, peaceful, or even perfect. But notice instantly when you start to feel uncomfortable, when you start to feel angry or frustrated or upset. It's great control to be able to take these self-compassion breaks where you can kind of see the craziness happening all around you, but you can see yourself in all of this craziness. And when that happens, you can be able to pull yourself out of it. I've had hard interactions and I've beaten myself up for things, but just like we've said, from every experience, there is something to learn. So ask yourself, how can that learning allow me to tap into greater reserve of compassion and courage to be better next time so that we can do better next time? Because we know we are not alone.
Yes, and when we remind ourselves that our suffering is not separate from the suffering of others, we lessen our individual pain. And that's how we strengthen our community and our connection with our learners. As you know, we as humans are wired for compassion. And it's so important to talk about because if we want to cultivate compassion in the training environment, we first need to extend that kindness to ourselves.
When people have very different experiences from me, I find it to be difficult for me to listen to other people's complaints without comment. I can find myself being judgmental in those moments. And when you are in that frame of mind, it is difficult for compassion to surface. I find that these reminders to be so helpful to get me to shift quickly from a place of judgment to a more compassionate space. I try to remind myself of these things daily so I can stay humble and continue to do my work in service to others. And we hope that in moments when you feel like compassion is hard to find, that these reminders can serve as a navigation tool to locate our own compassion reserve that many of us already have inside of us.
The first reminder is to practice empathetic listening. Rephrase the meaning and reflect the emotion. Think about where might I be able to meet this person in a space of commonality so we can find and plant the seed of compassion.
Pay attention to the story and narratives we are making up. Sometimes we create stories around situations, and instead of it serving us, it actually hurts us. Just like the example where the preceptor created a narrative around the learner overstepping and going behind her to provide a recommendation to the provider. It is likely that was not the intention of the learner. However, the story was written and we saw the result of what happened. Instead, we should get curious. Get curious about what might be going on for them. Remember that curiosity can broaden your perspective and as a result can open up more opportunities for connection.
It is easy for us to sometimes personalize what is happening for somebody else. I get it. I do it. Which ties back to the storytelling that we do. So it is helpful to remind ourselves that other people's behaviors and actions aren't necessarily towards us or even about us. I like the acronym QTIP a lot, which stands for Quit Taking It Personally.
That's a really good acronym. Remind yourself that people can change. This one is my favorite, and it is one that I think about often. To be a preceptor, to be an educator, means that we have to believe in the fundamental capacity for people to change, grow, and learn. When someone makes that decision that this person is no longer capable of such, we are no longer taking part in their growth or learning. When you hold the belief that people can change, it leaves you open to possibilities. And the last reminder is that at our core as humans, we all want to be seen, cared, loved, and valued. We have reached the end of this presentation. We want to thank you for engaging in and prioritizing your own learning and development. We hope that the information we shared today is useful and valuable. We know that there's always more to learn, and what we are learning requires a lot of intentional practice. So we hope that you'll be able to apply these strategies we discussed to cultivate curiosity and compassion in the spaces and places you are in, regardless of where you are.
We also want to thank you for the dedication and the quiet work that you do every day for our learners. It does not
Care
go
and be well.
unnoticed.